Hi, I'm Dr. Russ VanderWilde. The goal of this video is to make your day of surgery as smooth as possible. Today we're going to cover pain management, wound care, your exercises, and the use of either a sling or a brace. I hope you find this information useful, and good luck with your upcoming procedure.
On the day of your procedure, you'll have another chance to have your questions answered by your physician. And if you can think of anything else between now and then, just go ahead and make a list of those questions and we'll get them answered before we go ahead with your procedure. On the day of the procedure, you will also have both the surgical site and the type of procedure confirmed, and the site of the surgery will be marked with a permanent marker. This should give you confidence that the correct site, the correct extremity, and the correct procedure will be performed. The final issue is that the anesthesia team will meet with you on the day of surgery to talk about your options for anesthesia as well as the risks. For many of the procedures that are performed as outpatient, surgical blocks will be an option, and we would strongly encourage you to consider this if it is an option for your procedure, as it would greatly decrease the requirements for anesthesia. It would also facilitate your post-operative pain management and help speed up your recovery time. For the surgical procedure, there are often 3 separate medications that are used to provide adequate pain control. One is a long-acting medicine, one is a short-acting rapid onset medication, and the third is a potentiator medicine that helps increase the potency of the other medications. MS-Contin is the most common long-acting medicine. It's easiest to think of MS-Contin as a 12-hour pain pill. To avoid lapses in your pain control, it's best to take this on a pretty regular 12-hour interval or as close to a 12-hour schedule as you can accomplish. Even though pain management is our #1 priority, it can be a lot more convenient, especially if you're having a surgical block, to take the first dose of pain medication a little bit later in the evening. For example, if you're someone who gets up at 8 o'clock in the morning and you have a block that's providing adequate pain control, delaying the first dose of the long-acting narcotic or MS-Contin until 8 in the evening would make the 12-hour interval 8 in the morning, which is much more convenient. But if your block is wearing off and you're not getting adequate pain control, we encourage you to take that first dose earlier. As an example, if you took the first dose at 4 o'clock in the afternoon, you'd then have to take a 4 a.m. dose, which is obviously less convenient in the first few days after your surgery. So to clarify, pain management is the #1 priority. And if your block is wearing off and you're not getting good pain control, then convenience has to take a back seat. If your block is working well, we recommend that you try and delay the first dose of the long-acting medicine to a PM hour. That would be much more convenient for the next 12-hour dose in the morning, and this would help facilitate convenience of dosing. The second medication that we will have you use is the more rapid onset fast-acting medication. This is usually either Percocet or hydrocodone. These medications can be taken on a 4-hour interval and are best to be thought of as a 4-hour medicine. You can take either 1 or 2 hydrocodone or 1 or 2 Percocet every 4 hours as needed to control your pain on top of the MS-Contin. The third medication we are going to recommend is a medicine called Benadryl or diphenhydramine. Diphenhydramine is an antihistamine and has no pain medication effect or pain control effect on its own. Benadryl is a potentiator that makes whatever narcotic that's in your system more potent. It will make whatever morphine that's in your system approximately 30% more potent, or whatever Percocet or hydrocodone that's in your system more potent. It's best to think of Benadryl as being a 6-hour medicine because it can be taken on 6-hour intervals. It does not need to be taken at the same time as morphine or Percocet or hydrocodone. However, you have to have Percocet, hydrocodone, or morphine in your system for Benadryl to have a pain alleviating effect. So to clarify, you will have a long-acting medication, most commonly MS-Contin. You will have a short-acting medication, commonly Percocet or hydrocodone, that is dosed every 4 hours. And finally, you will have a potentiator of diphenhydramine or Benadryl, which can be taken every 6 hours. And with this combination, we are usually able to provide adequate pain control and at least take the edge off of your post-operative pain and facilitate an early recovery. Most times after your surgery, your wound will be covered with a bulky dressing. This bulky dressing, in the case of a shoulder, will be held on by foam tape. and in the case of a knee, will be held on by a compression wrapping. After 48 hours, we recommend that you remove the dressing and that the arthroscopy portals, which are the small incisions, be covered with a Band-Aid. If you have any larger incisions, we recommend that these be covered with a dry gauze and tape. When your incisions are dry and there's no drainage for 24 hours, at that point, it becomes safe for you to shower. Now, to clarify, you will change the dressings at 48 hours, but we would like you to wait 24 hours after that dressing changed to ensure that you don't have any drainage from the incision areas before you shower. When you do shower, we recommend that you avoid immersion in the water, like going into a regular bath or hot tub. It's okay for shower water to hit the incision area, but we would like you to just dab things dry with a towel. Not aggressively rub or scrub the area, and then after each shower, reapply a new set of Band-Aids over the incision and a new gauze over any larger incision areas. The signs of an infection would include redness, fever, or chills, or any kind of drainage other than clear liquid, clear yellow fluid, or blood. Clear yellow fluid or blood are very common after arthroscopy and should not be a concern. If you have any fever, chills, or drainage that appear to be purulent, thick, yellow, or pus, we should hear from you. That way we can address this before it becomes a bigger issue. Ice can be a very potent natural anti-inflammatory and should be thought of as being one of your biggest tools for post-operative pain management and a way to easily and safely decrease swelling and pain. Icing can be difficult, and the commercially available gel packs or pumps can be a big tool to help with that. If you find you don't have commercially available gel packs, unpopped popcorn can be a very safe and easy alternative. We do recommend that you use a thin pillowcase or small absorbent thin layer to prevent condensation in the area of the surgical incision. By doing this, you can also provide a thin layer to avoid frostbite. After your knee surgery, it is important that your knee be elevated close to the level of your heart. It's important that the knee be kept in as close to a straight position as possible because holding the knee in a bent position can lead to a flexion contracture and loss of ability to extend the knee. So ideally, in the first several days, although we want you to elevate the leg, we'd like you to elevate it with the knee straight. Elevation can decrease pain, swelling, and can facilitate your early post-operative recovery. Calf pump exercises are designed also to decrease swelling and increase circulation, and they can be very useful when your leg is elevated and icing. After your knee surgery, it is important that your knee be elevated close to the level of your heart. It's important that the knee be kept in as close to a straight position as possible because holding the knee in a bent position can lead to a flexion contracture and loss of ability to extend the knee. So ideally, in the first several days, although we want you to elevate the leg, we'd like you to elevate it with the knee straight. Elevation can decrease pain, swelling, and can facilitate your early post-operative recovery. Calf pump exercises are designed also to decrease swelling and increase circulation, and they can be very useful when your leg is elevated and icing. At your last clinic appointment, you'll be provided with a sheet of exercises. These exercises will include a calf pump exercise that is designed to facilitate early recovery by increasing the circulation to the extremity and decreasing your risk of blood clots. It should be performed on both the operative side and the non-operative side and is very simply pushing your toes down and then pulling them up in a smooth motion for 10 repetitions 3 times per day. The other set of exercises include a heel slide, which is best performed on a kitchen floor or a smooth surface where you simply pull your heel back toward your rear, and this exercise should be performed 10 repetitions 3 times per day. A towel roll extension exercise is good for obtaining full straightness or extension of the knee. You can use either a rolled up towel or a pillow and placing it underneath your ankle or your Achilles and allowing gravity to stretch your legs straight. And we'd like you to do this exercise 3 times a day, holding it for at least a 10 count in full extension with gravity. The final exercise is an isometric quad and hamstring set where you contract the anterior quad and the posterior hamstring together to provide a muscle contraction to decrease your muscle loss and atrophy that occur after a surgery. We would like you to perform these muscle contraction exercises 10 repetitions 3 times per day. If you have underwent a ligament reconstruction procedure for your knee, you will very often be placed into a hinged brace. That hinge is often set with different limits to protect your knee from stretching or injuring the reconstructed area. We would recommend that you do your exercises in the brace 3 times a day. The brace can be reset, and as you progress through your recovery, the limits on your brace may be changed by either the nurses, your physician, or your physical therapist. You should feel comfortable adjusting the Velcro on your brace, as the brace will tend to slide down as gravity pulls. Most legs are somewhat cone-shaped, and as the brace slides down, it will need to be loosened, pulled back up, and retightened. So feel free to adjust the brace, but expect to pull the brace up to keep it in the position that it was initially put in after surgery.
Hello again. We hope this video smooths your day of surgery experience. As your day of surgery approaches, I hope you'll keep a list of questions, and remember, the only bad question is the one that you forget to ask. Thank you for allowing us to participate in your care.